order. Welcome to meeting number 26 of the House of Commons Standing Committee on Procedure and House Affairs. How does this work actually, Justin? Do we still see the date as March 9th, 2021, or is the date March 11th?
It is March 11th. It is still technically meeting number 26, however, continuation of the meeting from 2 days ago.
I used to have some colleagues before that used to joke that, you know, the time, whatever time or whatever date you last left it at, but it makes more sense, I think, to just say it's still meeting number 26 as we only suspended last meeting. So we are picking up from where we left off. And today's meeting, as always, is taking place in hybrid format pursuant to the order from the House of January 25th. I believe, Mr. Clerk, nobody is there in person today. Is that correct?
That's correct. No one is in the room.
Okay. Well, in the room, just a reminder to anybody who is in the room that to keep the physical distancing that's necessary, to wear your non-medical masks when you're circulating in the room, and when possible, even when seated, and to use the hand sanitizer that is provided there. The rest of us are all participating virtually unless we have somebody sub in. That would be in person. So I will just be following along in the participants toolbar to see the order of hands raised, but we will pick up from where we left off last time and the order we left off in. If there's any points of order, then please, as always, unmute your mic, raise the point of order to get my attention, and then obviously we'll hear your point of order. And if somebody wants to speak to that point of order, they must raise their hand in the toolbar section. Don't forget to put your interpretation on if needed. You can choose floor, French, or English, and you don't have to switch between the two, but I would suggest maybe a few seconds of a pause between switching languages if you are going to speak from one to the other. And I think that's basically it. Make sure your mics are on mute when you're not speaking. And we will pick up from where we left off. Mr. Clerk, I believe we were on Mr. Lauzon, and then we have Ms. Petitpas-Taylor, and then we have Dr. Duncan, and then Mr. You'd have to remind me after that. I think you have the rest of the list.
That's right, Madam Chair. Mr. Lauzon has the floor, followed by Madame Petitpas-Taylor, Dr. Duncan, and then Mr. Blakey. Okay.
All right. So it's fine. You can keep your hands raised or you can unraise your hand since we have you on the speakers list in the proper order. Sometimes when you get disconnected, which did happen last time, and it's happened many times before too, when you get disconnected, your hand will automatically obviously get dropped off the list. But we are trying to keep a proper, accurate record so that we can see the difference. So we're monitoring when that change happens. But of course, we're only human. It can be overlooked. So please just raise a point of order if you think I have taken you out of the proper order that you should be in. So go ahead, Mr. Lauzon, please, you have the floor.
Thanks, Madam Chair. Bon matin, tout le monde. Merci.
Good morning, everyone, and thank you once again for coming today. I think all of our party leaders and our own leader has spoken to the importance of today. We've been reminded of how vulnerable, how fragile our system is. At our last meeting, I was talking about our health system and about the fact that it's broken and that it's fragile. And I'm the parliamentary secretary for seniors, and so I have been very affected by everything that has happened, and it continues to happen. Our leaders have all spoken and reminded us how important it is to continue to move forward, and how important it is as well to step back in order to be able to see what's happening. And we had to do this. We had to step back before that second wave. I was telling you how university professors told us that a reset was essential. If we're all here today, it's because some are trying to prove that prorogation wasn't essential, wasn't important. But we've heard speeches from our leaders, from the Prime Minister. And it's evident that it's important to step back in order to be able to be better prepared for the future, especially for our seniors who were so affected by the pandemic. This is an unprecedented pandemic. We have learned through this pandemic. We have had to make some very difficult decisions. And if we look at other countries, there were countries that had to decide who was going to die and who was going to live. We've had to provide equipment to our health system. We were able to do that, and now vaccines are coming. As the Prime Minister pointed out, the interpreter would like to point out that Mr. Lauzon's sound is cutting out, and there's interference. We're in politics to make changes, but we're also in a pandemic. We have to turn the page now, we have to write a report, and we have to move forward. From the very beginning, we haven't necessarily been here just to talk about prorogation and the reasons for prorogation. We're here for reasons other than reasons that have to do with the pandemic, and I'm being very careful in my choice of words. We've heard speeches, and I have been very emotionally affected when I think about all those families who have suffered losses. Our fathers, our mothers, our children, we all know people who have been affected by COVID. 20,000 people have lost their lives. That's not a small number. And we owe them something. We owe it to them to move forward and to set our politics aside. And the best thing our committee could do to show that we're doing this is to turn the page and to draft a report based on the considerable testimony that we heard, and to let our teams work to draft this report that will include recommendations. And we can continue having discussions about those recommendations, how we will move forward based on those recommendations. But this would be a great message to put out there. There are so many issues that we need to consider and that we need to consider quickly. There isn't a committee that is more important than the Procedure and House Affairs Committee when it comes to determining the direction that we're going to take and how we will deal with elections in the future. There are many issues that we need to talk about. When I was looking at this list, the list that had been drawn up in PROC meetings, I can tell you that I was very impressed. But I would like to be able to contribute to improving it, expanding it, based on the circumstances of today. And based on the circumstances of today, this list might look quite different. As Ms. Barbara Messamore said, from Fraser Valley University, one could say that given the crisis was not expected, this would have been a reason to bring forward a new agenda and a new speech from the throne. The speech from the throne was the springboard for all the decisions that we needed to make in the future. The opposition will hear this over and over again, but I don't think anything's going to change because they already had this preconceived idea of what they were going to say or think. And we've seen this. We've heard this. We've heard this through the questioning. These questions had already been predetermined. They implied that actually the opposition members already were seeking a specific answer. But the best thing that we could do right now is to move on to something else, and to work as a team for all Canadians so that we can move forward on issues that we care about. The prorogation report is a first. It's the very first time that a prorogation report has been tabled. And we didn't have to. You know, we didn't have to justify prorogation. In the past, no prime minister has had to do that. We chose to do it. There is no prime minister that committed to being absolutely clear on the reasons for prorogation. Now, one can make all the assumptions one would like. We're in politics. And during a 4-year mandate, many things can happen. And it's different when you're a minority government as well. But even though you're a minority government, you're still a government that was elected by Canadians. The majority decided that it would be Prime Minister Justin Trudeau and the Liberals who would govern in Canada, whether you like it or not. But we have to work together nonetheless so that we can meet the needs of our citizens. And so we need the recommendations to come out of this committee. And I'd like to come back to the report. I think it shows actually how irrelevant actually the motion on the table, the motion that we have before us is right now. Our government amended the standing orders so that future governments would have to be more transparent. And that's written in the report. Pursuant to Standing Order 32, it says that the report is going to explain the reasons for prorogation. That was in 2015.
Les gouvernements fédéraux futurs fassent toujours preuve de transparence envers les Canadiens dans tous les aspects de la gouvernance, dont le recours à la prorogation. Le présent rapport vise à apporter aux parlementaires et à tous les Canadiens plus de clarté sur les raisons pour lesquelles notre gouvernement a prorogé le Parlement en août 2020. Si on se souvient, en 2015, il n'y a rien qui nous indiquait
Appel au règlement, Madame la Présidente.
qu'on s'en allait en...
Point of order, Mr. Chairman. Point of order, Mr. Chairman. Forgive me. My colleague was speaking French, and I was hearing the interpretation into English. Forgive me.
Puis pourtant, j'avais vraiment mis... Ouais, OK, ça va. Mais...
All right, fine. Thank you very much. Is it working properly now, Mr. Terrien? Yes, it's working well. Thank you. Absolutely. Thank you very much.
Non. C'est tellement rare que j'entends.
No, it's so rare that I hear French spoken, Mr. Lauzon. I humbly encourage you to continue in French.
C'est excellent, soit dit.
And your French is English in passing. Thank you very much.
That usually solves the problem. Just the alert is usually enough. Thank you, Monsieur Theriault.
Bon,
Carry on, Monsieur Lauzon.
Merci beaucoup. Merci pour le retour.
Thank you very much. Thank you for the feedback. Yes, all this to say that in 2015, we didn't know indeed in 2015 that our government was going to be experiencing a pandemic. We didn't know that we would have to use prorogation at some point. These are decisions on the part of a transparent government that wanted to be transparent with Canadians. And it wanted to report to Canadians after prorogation. Without a crystal ball in 2015, we were struck by a pandemic. And there's nothing more justified today than putting out a report on the reasons behind prorogation. I would also remind you that we had to define our priorities and do a restart with a new speech from the throne, given the pandemic. And we had several discussions about this. The discussions we had pertained to the time. Is it too late, too early? Why didn't we do this at the beginning? We heard testimony. Witnesses told us in questioning that this prorogation should have happened at the beginning without having the facts, without knowing what was going to happen in the context of the pandemic, without knowing what was going to happen with our seniors, with the mortality rate, and today it's even more current with the variants, vaccination, the discussion surrounding vaccination with the provinces and territories. Taking a step back wouldn't be too much yet again today. Had we done something at the outset, a lot of elements would have been missing. And let's remember that we have science behind us and our professionals helping us make decisions. Science and our health professionals, how could they have defined, determined, announced the future of this outbreak if at the beginning we had prorogued at the very outset of the crisis? The timing isn't perfect, perhaps, but it was appropriate then to prorogue, and it became clear during the first half of 2020 that the speech from the throne of 2019, with which the government obtained the confidence of MPs in the House, no longer fit with the context in which we were governing. This reversal was caused by the pandemic. Once again, we didn't have a crystal ball when we delivered the speech from the throne in 2019. You give a speech from the throne to restart, reboot, relaunch the government. And all of a sudden, we're struck by a pandemic with which our values had to change. So it is important to redefine our direction. That is one element that we didn't take into account the last time that I intervened before the committee. This came to me afterwards in my reflection. We reacted very quickly and concretely to support our healthcare system throughout the country. The Prime Minister announced for provinces and territories on March 11th of last year, $500 million for healthcare. This was a major decision to be taken to help our healthcare system. When we say that, we heard some people say at times that the government isn't supporting healthcare in some provinces. Well, we've never done as much for healthcare with this government. We worked very closely with public health to deliver all of the necessary equipment and give support even for ventilation systems, etc., to help with long-term care, without forgetting the Army, the Red Cross. So we were there for the provinces and territories. And that sets the table somewhat. In summary, my orientation at the last meeting is what led me to what I have to put out to you today. In fact, I want to talk about the measures. We put in place several programs to help Canadians during this crisis. But we knew that the second wave was coming. And I also wish to quote this on page 5 of the report that I was able to find. Thanks to these initiatives without precedent nationwide, Canadians succeeded in flattening the curve. Our fight against COVID-19 wasn't, however, over. Indeed, on August 17th, the day before prorogation, Dr. Theresa Tam, who is our Chief Public Health Officer, indicated the following. And this is what is important. At present, our efforts are indicating that we are holding the spread of the virus at a manageable level, but the virus continues to circulate. We especially must be careful and not let down our guard. And we're thinking of the impact COVID-19 could have in the fall, depending on our collective commitment and the measures we will be taking to maintain the spread at low rates. Why did I read this paragraph to you? Well, it is because Dr. Tam, had she at that time heard talk of variants, of consequences brought about by the variants, had she heard of other considerations than flattening the curve, she would have mentioned that. Just to explain to you how quickly things can evolve with this pandemic. In July, because of the summer, people gathered more. We all heard stories about this in all of our ridings. There was a major youth gathering in my riding. We saw weddings, and people did gather in higher numbers. And cases spread through these activities. And we were once again plunged in red zones, but we couldn't have taken a clear decision to prevent what happened. We told people to wash their hands, to respect social distancing, to stick to their households, but overall, people did listen to the advice and they did persevere throughout the pandemic. But it's a minority that is such that we're having difficulty containing the virus because it is spreading at an incredible rate. When one person is infected, the whole network is impacted upon when people bring the virus home. We must have a special thought for all of our healthcare system. These essential workers were in contact with the virus every day, came home, saw their family, their children, went back to work, and vice versa. These were very courageous individuals carrying out this work during the pandemic. They put themselves at risk. Some of them were struck down by the virus, by the pandemic. And indeed, it wasn't easy for all of these workers, ambulance drivers, first-line workers, doctors, the people who work in grocery stores and pharmacies. They never let up, and we talked about this in the House again this week. We reminded those who ensure our supply. Well, we have the manufacturers, not just them. We have the truckers who cross from Canada to the U.S., who travel back and forth to provide Canadians with what they need, the products they need. There could have been shortages, extreme shortages of products during this time. We didn't sense any crisis, be it for gasoline, for essential goods, toilet paper, other items. Everyone did his or her part to allow society to keep functioning during the pandemic, and we did manage to control all of the inputs and outputs to ensure good supply to Canadians. On page 6 of the report, there is mention of putting in place a plan and to recenter, refocus our priorities to face the pandemic. In August, despite the flattening of the curve in certain regions of the country and our preparation work for the fall, it was already clear in August that with the colder temperatures, there would be an uptick of the number of cases as well as new difficulties. And the need for us to prepare was underscored. As I was saying, we were coming out of this summer. The cold weather was coming, and we know what happened. Medical specialists throughout the country clearly explained that the question wasn't whether or not there was going to be a second wave, but rather to what extent this wave would be devastating. When I read this in the report, I say this. It allows us to understand even better why we have to take a step back in order to make decisions. At the end of the first wave, people were exhausted. They were out of steam. The emergency wards were full. There were no beds available in our hospitals. We had created improvised zones in hospitals. I visited 2 of them when I went for my COVID tests. And there were barricades set up. People were improvising with plastic sheeting to isolate people in zones as soon as people had COVID symptoms. And all of the work that was done in advance, in preparation for what was going to happen in healthcare, we had to be prepared. And no one could have predicted the role that the second wave was going to play within the healthcare system. We had to prepare ourselves for this. To what extent will this wave be devastating? We don't know. We knew that some regions of the country would have to go back into shutdown. We had police officers checking vehicles as they move from one region to another. In my riding, there are an awful lot of secondary residences and cottages. In several of my municipalities, there was no one left. People couldn't go to these properties because they were in lockdown. When we talk about lockdown, we talk about closures of restaurants, etc. We know that the tourism industry was deeply affected. There are beautiful spaces, places in my riding that depend solely on tourism, glorious landscapes, and we know that traveling was no longer permitted and tourists weren't coming. And it's difficult to see the economy continue to function when there are no tourists and you count on tourism. We know that there were going to be more and more people who would fall ill and lose their lives. And that was the worst thing. We knew that the second wave was going to continue without our having the vaccine at the time. And 5 months later, 5.5 months after the beginning of the pandemic, we saw the most colossal crisis that this country has endured since the Second World War. And the Canadian population, the Canadian people, had to know that the Canadian government was going to be courageous. There is nothing more important than to be able to tell Canadians what the government was going to do, could do, to help them overcome all of the difficulties that might come.
De livre d'instruction qui vient avec une pandémie. On a un gouvernement qui fait en sorte qu'on essaie de prendre les meilleures décisions possibles. On travaille aussi.
The government has to make the best possible decisions, but we're working with other parties as well so that we can get through this as a team. And I don't see how much clearer it could be. It's not what opposition... I don't know how many more reasons opposition parties need to have. I could talk for hours about the causes of this prorogation and how it was important to work on this because of the pandemic. But at this time, I will let others have the floor and continue with this very important debate. But I will come back later to explain some more why I hold this opinion. Thank you.
Ms. Petty-Pat-Taylor. You're on mute. Sorry, I didn't notice your lips moving, so you'll have to start all over. Yes. No, I can't hear you still. No. This is the same problem I was having this morning. I was trying to do my sound check, and even though I was unmuted, I couldn't be heard.
Madam Chair, I had the same problem yesterday and had to reboot my computer. It updated. It took an hour and a half, and then today it's now working much better. So I don't know. It could be that. Just a thought.
All I did was sign in and out, but you could probably, rather than that, I don't know, let's hear from the clerk. He probably got some advice from the IT. Maybe you could just pull out your headphones and put it back in or something.
Madam Chair, so we're trying to figure out what that issue was because Madame Petty-Pat-Taylor's audio was working fine when we were doing the sound check. So
yeah.
Just 1 second. Madame Petty-Pat-Taylor, is it possible that on your headset, the cord for your headset, the little button? Yeah, similar to what Mr. Lauzon is showing you. There's a little button, and sometimes the mute gets hit on that.
If you hit the mute.
Can you hear me now?
Oh, yeah, perfect.
We can hear you. Perfect. Thank you so much. Sorry, I know I take your point too, Dr. Duncan, that our committee hearings and a lot of on-the-record time, I think, in the House and in our committees is going to be spent saying, am I on mute? Am I not on mute? Can you hear me?
Correct.
Yeah, well, I guess those are the times of COVID.
But super.
My sincere...
Monsieur Therrien, we can hear you. Okay, carry on.
My sincere apologies about that. So first and foremost, I wanted to say hello to all the members and a special welcome to Scott Sims for joining us today. Scott, we know you have a long history with PROC, and we really appreciate having you with us. And I have to say to start off, I'm not as eloquent perhaps as Stéphane. I can't seem to talk as long, but anyways, I will certainly do my best in order to address, this really important motion. And I appreciate the comments that Stéphane and that Ryan have made over the past while. I have to say as well, I missed a few meetings because of the Board of Internal Economy, and I felt really bad for that because I missed a part of the debate. But today, I certainly wanted to continue on the theme that I had spoken about last time, which was about kind of I guess that the opinion of the opposition as to why prorogation occurred has already been made up in their minds. And I guess I really wanted to address that. Ça fait que pour débuter aussi, je vais donner peut-être une pause à Monsieur Therrien, qu'on va continuer à parler en français.
So I'll give a little pause to Mr. Therrien. I'll speak French because it's hard for Mr. Therrien to deal only with the interpretation, which we appreciate, of course. But it is tiring to listen always in their second language. So most of my comments today will be in French. And the Acadian from New Brunswick here always appreciates the opportunity to speak in her mother tongue. And I will go on talking about the motion then. For the Canadians who are listening to us right now, we've spent many hours already debating this motion. And the motion was tabled by Ms. Vecchio. But I think we need a little update. A lot of people who are not aware of what this motion deals with. Of course, it's always the same motion, but for some Canadians who are listening to us right now, I think it's important to come back to the motion itself and explain it. The motion was tabled by Ms. Vecchio, and it said that in respect to the committee's study of the government's reasons for the prorogation of Parliament, that the committee renew the invitation issued to the Prime Minister to appear before the committee, provided that if he does not agree, within 1 week of the adoption of this motion, to appear for at least 3 hours, the chair shall be instructed to report to the House forthwith a recommendation that this committee be empowered to order his appearance from time to time. B, that the committee renew the invitations issued to the Deputy Prime Minister and Minister of Finance and the Minister of Diversity and Inclusion and Youth, each to appear separately before the committee, provided that in respect of each of them who does not agree, within 1 week of the adoption of this motion, to appear for at least 90 minutes each, the chair shall be instructed to report to the House forthwith a recommendation that this committee be empowered to order her appearance from time to time. C, that the committee renew the invitations issued to the Honourable Bill Morneau, to Katie Telford, to Craig Kielburger and Mark Kielburger, each to appear separately before the committee, provided that in respect of each of them who does not agree, within 1 week of the adoption of this motion, to appear for at least 3 hours each, a summons do issue for his or her appearance before the committee at a date and time determined by the chair, but no later than 1 month following the adoption of this motion. D, continuing on, that the committee renew the invitations issued to Farah Perel-Mutter and Martin Perel-Mutter to appear before the committee, provided that if they do not agree, within 1 week of the adoption of this motion, to appear for at least 90 minutes, a summons do issue for their appearance before the committee at a date and time determined by the chair, but no later than 1 month following the adoption of this motion. E, that the committee issue an order for the production of all memoranda, emails, text messages, documents, notes, or other records from the Prime Minister's office and the Privy Council office since June 25th, 2020, concerning options, plans, and preparations for the prorogation of Parliament, including polling and public opinion research used to inform the decision to prorogue Parliament, provided that these documents shall be provided to the clerk of the committee within 2 weeks of the adoption of this motion. F, that the committee issue an order for the production of records of all communications between the government and any of We Charity or its affiliated organizations, Craig Kielburger, Mark Kielburger, or Speaker Spotlight, since June 25, 2020, in respect of the prorogation of Parliament, provided that these documents shall be provided to the clerk of the committee within 2 weeks of the adoption of this motion. I'm almost done. G, that the committee issue orders to We Charity, including its affiliated organizations, Craig Kielburger, Mark Kielburger, and Speaker Spotlight, for the production of all memoranda, emails, text messages, documents, notes, or other records since June 25th, 2020, concerning the prorogation of Parliament, provided that these documents shall be provided to the clerk of the committee within 2 weeks of the adoption of this motion. And finally, H, that all documents provided to the clerk of the committee in respect of paragraphs E to G shall be published on the committee's website as soon as practical upon receipt, once they are available in both official languages. So that is the motion that we've been debating for several meetings. And the last time I had an opportunity to talk about the motion, I said that the issue of prorogation has been studied for several weeks already. And during that study, we heard from many experts, from academics, and from Pablo Rodriguez, who was a witness with his officials, and they gave us the reasons why they chose to prorogue Parliament. I think my colleagues have mentioned already that if it's not because of the greatest sanitary crisis we've ever had, if that wasn't a good enough reason, I don't understand what would be. And I have to mention that if you look at the opposition, you'll see that their mind is made up. Many comments have been made by members of the opposition. And even this week, I was on duty in the House for a debate that was prolonged. I was one of the lucky ones that was there for that evening. And still, some opposition MPs were saying that the reason for the prorogation was linked to We Charity. So you can see that this whole issue of the reasons for prorogation is something that is a given for opposition members. And I would say that it should be quite the opposite. In 2019, the last election, I had thousands of voters talk to me, and I listened to them. And I was sharing my ideas also with my colleagues. And the speech of the throne from 2019 reflected, obviously, the government's priorities for that time and the priorities of Canadians. But 2020 is a completely different situation. It's the first time that we're facing a crisis like that one. It's a worldwide crisis. It's not just in Canada. It's all over the planet. And Canadians' priorities have shifted. So the government had to have a reset, choose new orientations, and take a step back and determine what was the priorities, what were the priorities now, and how to react to Canadians' priorities. And when I say that the opposition have their mindset already, I should still quote some people. And the first one is from my colleague from Halliburton, Kawartha Lakes, Brock, Jimmy Schwirl, who has also sat on PROC in 2015, 16, and 17, and I've always had a lot of respect for that MP, who said, I don't think it's a secret that the Prime Minister, we know, has decided to prorogue Parliament because of his involvement in the We Charity scandal. After what the Governor-General has said, nothing in the Prime Minister's speech last night, there was nothing there that could not have been announced in a normal press conference or in the House of Commons itself. Of course, the Prime Minister, as many people have said that this was not a partisan politics issue, but rather a speech to the nation about the COVID pandemic. But we know what happened, and it is just another proof that he was pulling the wool on our eyes. So once again, a colleague is saying that he or she already knows what were the reasons for the prorogation, even though we've had many witnesses at the committee. So their position is that the prorogation was just politics and just a diversion. I want to say that the Canadians were given a speech about their day-to-day lives by the Prime Minister. the citizens in my riding were saying, Ginette, at 11:30, I'll be watching TV and I want to hear the Prime Minister. I want to know what the government is going to do to help us. And I must say that it's probably everybody's reality.
I was making calls and I was also listening. This wasn't a political address. It was a hopeful address. Do you know, I walk around the park nearby, and I want to say that when I was doing my walks, people came up to me and wanted to thank me. They wanted to thank me for the work we're doing, for the support we're giving them. And I'm not talking about the speech from the throne in 2019. What I'm saying is that people were talking to me about how happy they were about the support they were receiving. Now, was it perfect? No. We didn't get a set of instructions on how to deal with this. However, along with other parties, we worked hard. And when I hear that this has purely been a political exercise, I absolutely disagree. And the speech from the throne wasn't for political reasons. Yes, there are some things that overlap between 2019 and 2020, but there were also issues that were specifically dealing with the pandemic. I'd also like to share another quote with you. It's from the member from Similkameen Nicola. I'm sorry, I perhaps did not get the name of the riding right. I apologize rather. But he said the Prime Minister prorogued the Parliament to avoid the WE scandal. We all know that following prorogation, the government announced benefits through legislation. Rather than spend time over the past month to debate on those benefits, the Prime Minister just shut down Parliament. Now that these benefits have come to an end and Canadians are no longer eligible, the government is simply playing politics. Once again, we've heard about this shutdown of Parliament, but we lost less than 2 days in the House of Commons. We took the time that we needed to reassess our priorities and ensure that we were using the right guidelines, that we were going in the right direction to support all Canadians throughout the greatest health crisis we've experienced. I'd like just to quote someone else from the member for Selkirk, Interlake, Eastman, Mr. Sanson. On the 5th of October, he said this. He said that the only reason why there's been a prorogation, and given that the speech from the throne was so uninspiring, is the WE scandal. So this is not a reset, he said. As I said, this was not a reset. It was rather an attempt to try and conceal the truth and make sure that opposition parties could not continue to hold the government to account on the loans of billions of dollars and the billions of dollars that were going to be managed by the WE charity. Well, once again, when I hear that the speech from the throne was uninspiring and that this wasn't actually a reset, I would say this. I think it's a bit rich, actually. You know, sometimes we hear from the opposition that this wasn't a reset, that we just simply carried on with the same. I've read both speeches from the throne. And when I look at the 2019 speech and the 2020 speech, yes, there are overlapping themes. Obviously, we're going to speak about climate change both times. Even if there's a health crisis, there are other crises like the climate crisis that are ongoing. But in 2019, when you look at our key priorities, it was actually mainly to tackle climate change. I had knocked on doors and made phone calls at the time during the elections. To my surprise, there were many, many seniors who wanted us to tackle climate change, and they were talking to me about this. It wasn't something they were as familiar with, but their children and their grandchildren had been talking to them about it, had been educating them about it, actually, and about the importance of climate change. And they wanted to make sure that we, as a government, were going to do our fair share of work to make sure that we met our targets. So there was that issue of climate change, and climate change continues to be a priority. We had also set some very ambitious targets. There was also the issue of the green economy and the growth of the green economy. Obviously, we wanted investments to be made in that area. And I think the government set out a good roadmap in 2019 in its speech from the throne. There was also the issue of the middle class and strengthening the middle class. I have been a member of parliament since 2015, and I'm very pleased with the steps that we have taken to help the middle class, to help people who have lower incomes. We've helped them through benefits for their children, for example. So we can't just stop trying to strengthen the middle class. We're going to continue. There's also the issue of reconciliation. We must continue to do the work when it comes to meeting the goals that we set and that Indigenous peoples have set, because we have to work together. We have to work together and go down paths that we have decided on together so that we can meet our goals. And there's also the issue of the health and safety of Canadians. Obviously, this is a top priority. There's also the issue of firearms. Many of our constituents have spoken to us about firearms. They want our government to address the situation. As a former social worker, I've seen the devastating effects of firearms. There are statistics out there that I am not proud of. In New Brunswick, there is domestic violence and there are suicides. And unfortunately, we are at the top of the list when it comes to these issues. So there remains a lot of work to be done, and we will continue to do that. And I assume that, like in Atlantic Canada, it's very difficult to access physicians and family physicians. We heard people, we heard what they had to say, and we want to make sure everyone has access to a family physician. There's also the issue of coverage, of medication coverage. This is a priority for Canadians. And when I was the Minister of Health, I worked on this issue, and we're going to continue to work on the issue of pharmacare. We need a national plan. Now, I could go through all the speeches from the throne. I'm not going to do that. I'm not going to go over each and every page of the speeches from the throne, but I would like to compare the two. Because I was just talking to you about the 2019 speech from the throne. But here we are now, we were in 2020. And in my riding, for a good year now, I have been in my riding.
Point of order, Madam Chair.
Yes, Ms. Vecchio.
Hi, I've really appreciated all of the comments coming from all of our Liberal colleagues and sharing with us the devastating impacts that we are all aware of with COVID. And I just wonder if we can get back to the actual motion on hand again. We've seemed to go very, very far out, and I'm just wondering if we can bring it back to the actual motion. We seem to speak a lot about the throne speech and going into other matters there, which is fine. But if we could get back to the motion and perhaps, maybe there are some clarity specifically what they don't want to see, if they look at the motion, who they don't want to appear. Maybe there's some actual information on that. So if we could get back to the motion on perhaps why they're want to vote against it rather than everything else. Thanks.
Sure, and I'll remind the member to stay on point, although I think she was talking about the issue of prorogation. But also to all the members, as we know, this is not our first meeting with a lot of interest and lengthy debate on this motion. So I'm hoping that perhaps we can come to some type of, or the members can talk about maybe eventually either coming to a vote or some kind of agreement on the motion, but I guess we'll continue to hear from the members, and hopefully there's some proposals that are put forward at some point. And I do also miss now that I just...
Yeah. Sorry, Madam Chair, just on that same point of order. I mean, it is difficult to make proposals. Liberal members are speaking a lot and not making proposals, and I've been on the speaking list for some time. It's hard to make proposals when you don't have the floor. I've just remind committee members of
that. Sure, absolutely noted, Mr. Blakey. You are on the list after Dr. Duncan today. So I'll allow, obviously, Ms. Petitpas-Taylor to carry on with her remarks, and thank you for all of your contributions. One more thing, though, there is a subcommittee meeting after the scheduled time of this meeting today at 1:15. That's the subcommittee on private members' business, and I know that that's important to all of our members to make sure that private members' business can continue forward. And so hopefully we'll maybe we can address that closer to the end time, and if there is agreement again, you can let me know at that point.
Point of order, Madam Chair.
Mm-hmm.
I recognize the issue with the subcommittee. That is really, really important. And because I recognize that this would be another day of filibustering, I know that there is very little change in today's schedule, as well as the subcommittee business for members. It is relevant for the work that needs to be done on April the 14th. So we do have ample time, just in case we do need to reschedule that as well. So I just want to keep that as in the next hour, just as a side note that we could perhaps look at having to do that at another time. We do luckily have some time on this, so thank you.
Okay, thank you. Ms. Petitpas-Taylor, go ahead, you have the floor.
Merci beaucoup, Madame la Présidente, pour adresser un peu.
Thank you very much, Madam Chair. And just to speak to what Mr. Blakey said, I just wanted to say that I was on the list for a long time too, and I had many things I wanted to say. Sometimes we get impatient, I realize that. I know that sometimes it takes some time to get a chance to speak. I know Ms. Duncan also would like to speak. We have to hear what everyone has to say. So I'd like to come back to the motion. Madam Chair, I'm going to be honest. I do think that my comments are relevant to the motion, because I was saying that I think members of the opposition had already made their minds up. And there were valid reasons why our government decided to prorogue. And we're being told that the speech from the throne was irrelevant, uninspiring. So I do have things to say, but I will attempt to be brief so that everyone gets a chance to speak. So I think I'm just going to give you a quick overview of what I think the highlights were in the 2020 speech from the throne after the prorogation. And I think what was most important, in my view, was the focus on protecting Canadians during the second wave of the pandemic.
Perhaps we don't remember what happened then, but we were envisaging what would happen with the second wave. And in the Atlantic region, perhaps the situation wasn't as clear, but there are several regions, ridings, and provinces that were quite hard hit by the second wave. And we wanted to ensure that we would be able to help Canadians and SMEs to ensure that they would be able to maintain their activity. The government, as I outlined, continued to focus on help for Canadians during the second wave. Also, we wanted to truly ensure that there would be programs to build back better. We talk about building back better. In French, it's rebâtir en mieux. And we want to ensure that we're not just building or rebuilding the same thing. There were programs in place that were good, but we knew that were shortcomings. So why not take the time at that time to restart these programs, to reboot them, especially for Canadians who are vulnerable? All Canadians need their fair share and the same opportunity to succeed. I know that for myself, it's really a priority, and this is one of the reasons that led me to a life in politics. Another thing, too, the pandemic truly brought out the fundamental inequalities that exist in our society. We saw that some sectors of our population were negatively impacted upon by the effects of the pandemic. So once again, the government really wanted to ensure that there would be programs and monies invested in that initiative. One thing that was really important to me was the issue of homelessness in my little community of Moncton. Who could have known that people would be living in tents? We'd never seen this. And now we're seeing that there are several homeless people in our community, and we needed to invest in housing. And this is a program that was able to benefit several organizations throughout the country. It was $1 million that was invested. 500 million had been given to municipalities, but another 500 million was there for various groups. And I'm delighted to say that there was a program in my riding that received money, and we're going to be working in close cooperation with other interveners to ensure that housing is created to assist this community of homeless individuals. My colleague Stéphane mentioned this, the idea of developing national standards for long-term care. We all know, and I was looking at the numbers yesterday, and if I'm not mistaken, as of yesterday in Canada, we had 22,335 Canadians who lost their life because of COVID-19. And I have my heart in my throat when I speak to this. These are parents, our brothers, our sisters, people close to us. Just before the pandemic, at the very beginning of the pandemic, I lost my mother. She was in a long-term care home, and I miss her every day. I have her picture here on my desk right next to me. But I'm so happy that she didn't have to live in a long-term care home for a whole year. I don't think my mother could have survived without seeing her daughter throughout that lengthy period. So it is very important that provinces and territories work together to ensure that we establish national standards, because this responsibility doesn't just fall upon the provinces and it doesn't just fall upon the federal government. We must all work collaboratively to ensure that our seniors are well taken care of, because as I stated, I lived for 10 years with my mother in long-term care situations. I saw people die in these homes. There are things that we can do. There's essential investment that we can do to ensure that our seniors are well taken care of. Forgive me, Madam Chair, I didn't expect this to happen. And we also must help our women enter the workplace. Because of the pandemic, we saw that women suffered immensely. Often women had to stay at home. Not just women, but oftentimes women had double duty issues. They had to work from home and take care of the children at one and the same time. And we're seeing the statistics. An awful lot of women will not be returning to the workplace because of the pandemic. So we have to ensure that we do address this issue. We need a national childcare system. And once again, I was delighted to see this in the 2020 speech from the throne. It is clearly a priority. Once again, we must also recognize, but because of the pandemic, there were programs put in place to help Canadians. I'm not going to go through all of the programs, but clearly during the pandemic, the government put in place excellent programs to support individuals and families. For example, EI, the Canadian wage subsidy, the commercial assistance program. There was also support for mortgage repayment. So perhaps the programs put in place weren't perfect, but we are making adjustments to make sure that Canadians have assistance. We asked them to stay at home to prevent the spread of COVID-19, but we also told them that we had programs to help them. Finally, another element that was very important is the organizations assisting individuals. As I've shared with you several times, I was a social worker. I'm a social worker by training, and it's social workers who offer assistance in our communities. So when I hear opposition members say that our speech from the throne wasn't very inspiring, how can you be more inspiring than when you're helping individuals, businesses, and nonprofits? In my riding, I must say that there are people who are doing exceptional work. And when I say exceptional, I really mean it. They're working very hard. They don't necessarily earn big salaries, but they were there day in, day out during the crisis, and they're still there today. And with the programs that we were able to put in place to assist these organizations, several of them in my community really benefited from the additional monies that were distributed to offer additional assistance in our communities. For example, a small company that was launched in Moncton called Inspiration Cafe. Thanks to the United Way, they established a little cafe for people who suffer with intellectual issues. They go there for training. People in the community want to support this business that hires people with intellectual disabilities. They go there for a coffee, for lunch. Because of the pandemic, they had to shut their doors. But those individuals wanted to continue to work. They were really suffering from not being able to go to work. So United Way provided monies, but they weren't able to open their doors. So what did they do? They started to prepare meals for seniors who couldn't go to food banks. So twice a week, there were volunteers who helped the employees prepare meals. And from there, volunteers delivered these meals to seniors in their homes. So they at least got 2 meals, very healthy, very good meals every week, provided by this group. During the Christmas period, there were volunteers with children who wanted to spend time with their families. So I had the opportunity to go and spend a bit of time there. I did a bit of cooking there too, and I also made deliveries, and we saw that people were very appreciative. And once again, these investments were made during the pandemic. And this organization, I don't know if I mentioned it, but they're preparing 600 meals for seniors per week. So it's quite impressive indeed. Another organization that received monies was Alternative Residences, Résidence Alternative. It's an organization that offers housing to people who have mental health issues, once again. And because of the pandemic, there were restrictions with regard to visits. So the monies that were distributed allowed the establishment of mechanisms whereby people could respect social distancing and visit with their relatives. The speech throne, once again, and all of these investments really contributed to all of this. The Alzheimer's Society also established a program here in New Brunswick, in my riding. And once again, the Alzheimer's Society offered day visit centers for drop-in centers for people living with Alzheimer's, once again with investments that allowed for training, etc., for family members in order to be able to respect sanitation rules, healthcare standards, and continue with their activities. Once again, Big Brothers and Big Sisters is another organization. Once again, they remained active throughout the pandemic. Clearly, in-person visits were not possible, but what they did, thanks to the investments made, they were able to develop digital spaces for meetings using Zoom, etc. So once again, they were able to benefit from the investments made. Another organization, the Boys and Girls Club of Moncton. They really were innovative. They did their utmost. This group serves a multi-ethnic population, and they wanted to ensure that youth would be able to continue to maintain their contact with the centre. I was privileged to participate in an activity. They asked several community leaders. They wanted to ask us to prepare a meal, and it was to be filmed. Young people would be able to prepare the meal with us via Facebook. So I find recipes that were quite amusing, quite fun for young people. Once again, it was very inspiring. We sought out these young people who were having difficulties without having their usual social contacts with their peers, etc., during the pandemic. It was very difficult for them, this isolation, so it really helped them. And briefly, I'm watching the clock, and I want to ensure that my colleague, Dr. Duncan, will be able to share her comments today. But another agency that greatly benefited from our investments was the Ensemble Greater Moncton organization. Ensemble is an organization that offered a lot of services for people who were affected by AIDS. Ensemble Moncton today works a lot with people who are facing addiction issues, etc.
CEDA AIDS Moncton, or Ensemble Moncton, was very fortunate that during the pandemic they've received some additional funding. And what they were able to do, because they oftentimes provide harm reduction supplies to people who use drugs, they were not able to have that frontline service with them because oftentimes their agency was closed because of different colorings, that we were going into red zone and orange zone, and their agency is really small. But because of some funding that we've been able to provide for them, they've been able to purchase 2 computerized interactive harm reduction resource dispensers that are available for people with addictions and disorders. And the neat part about these machines, I mean, New Brunswick is a pretty cold province and we get a lot of snow, but these machines are just outside and they're centrally located in our downtown, and they have all of the safe supply needs that they need. And it's all, the temperature is controlled. So even if they want condoms or whatever the case may be, the temperature is not going to affect the security of any of the products that are given. So it's really quite something else, you know, how we've come a long ways. And as well, because of the pandemic, they've also made sure that there was face masks that were available in the dispensing machine, that they had hand sanitizer, and this was all free of charge, and it is free of charge. So we wanted to make sure that people received the safe supplies that they needed if they were using, and the pandemic should not, you know, put a barrier to that. And Ensemble Moncton has done has offered tremendous services over the past years to the community. And I was really, really proud to be able to go and to see them as they moved forward with the installation of that program, because it was just so important. And finally, one other comment that I'm going to make as well is and again, I could go on and on because I've got so many great agencies, as I'm sure that most of you have as well. But the issue of the Greater Moncton Multicultural Association in Moncton, which is a settlement agency that receives a lot of people. And during the pandemic, they were overwhelmed with a lot of newcomers that just didn't know what to do. And they were provided with additional funding. And at one event that I had just before Christmas, I asked for them to share with me kind of what difference that made in their life and in the lives of their clients. And the director of the Multicultural Association had just indicated to me that because of the pandemic, some people had lost their jobs, and because of the waiting period for the different programs, that one particular client needed medication for their diabetes. And because of the funding that we were able to provide to them, it bridged them. So all that to say, when I hear folks say that, you know, the throne speech and the work that we've done is just wasn't inspiring, it was just the same, I'm like, no, I have to challenge that. We are here to help Canadians. We are all here to help Canadians. It doesn't matter which party we're in. And I think when we work together, we come up with better policy. We really, really do. And when we keep politics out of it, and I know we're all politicians. I mean, you know, that's who we are. But I think that we can accomplish so much more when we work together. And I know during the pandemic right now, people don't want us pointing fingers. It's not who's doing what. They just want us to get the job done. And I think if that can be our focus, Canadians are going to be well served by that. And having a minority parliament is a time for that as well. You know, we have to take each other's feedback and move forward with the best policies forward. So with that, I still have an awful lot of other comments that I can make, but I really want to make sure that my friend and colleague, Dr. Duncan, is going to have an opportunity to share her comments. I'll come back. I'm sure we'll perhaps have another round. But Dr. Duncan, we missed you for a few weeks that you were away. We're really happy that you're back with us. And I really want to thank the committee for allowing me time to speak and to share a few thoughts on this issue. Merci beaucoup.
Yes, indeed. We're very happy to have you back, Dr. Duncan, and thank you, Ms. Petitpas-Taylor. Go ahead, Dr. Duncan, the floor is yours.
Thank you, Madam Chair. And I think before I start, I'll just acknowledge that today we come together.
Your mic, I think it's up. As it is. Okay.
Better? Is that okay? I don't want to hurt our wonderful interpreters. Dear friends, Madam Chair, before I start, I really feel I have to acknowledge that today we come together to remember, pay tribute, and to grieve all those we have lost to COVID-19. And we reflect on the sacrifice, the hurt, and suffering, and we offer comfort to doctors, nurses, frontline workers, survivors, families, and communities. And we promise to learn the lessons. I'd like to say thank you to my extraordinary colleagues, Ryan, Stefan, and Jeanette for their speeches. And Jeanette, most recently, I want to thank you for your caring. And we are all so profoundly sorry for your loss. To my dear colleagues, my apologies for my absence recently. I have missed you all. And at this time, I think it's nice to be able to celebrate. And so to Peter and his wife, a very happy 40th wedding anniversary. We all need some light. Happy anniversary, Peter. When it comes to the motion, look, I understand the politics of this motion. However, every single day, Canadians are becoming sick with COVID-19. They are being hospitalized and they're dying. Our focus has to be Canadians. The COVID-19 pandemic remains a public health emergency, an economic crisis, a social crisis, and a human rights crisis. And there is nothing that is more important than fighting the pandemic. And we are still fighting the pandemic. We have new variants. And even if we suppress the virus in one country, but it is allowed to spread to other parts of the world, the variants and perhaps with new mutations can cause new outbreaks. And even in countries that seem to have the virus under control, we have all endured a year of tragedy and crisis. COVID-19 is the most challenging crisis we have faced since World War II, and it's not finished. And yet we are arguing over politics. Moreover, as countries and communities continue or fight to contain cases while rolling out vaccine, the global rollout has been far from even and fair. As of mid-February, 130 countries had not received a single dose of vaccine. and just 10 countries had administered 75% of all vaccines. We must remember that we are one human family. We are interdependent, and what happens to one person can quickly affect many others. A cluster of pneumonia cases just over a year ago has translated into over 117 million infections and 2.6 million deaths. If we do not ensure vaccine equity, the virus will continue to spread, to mutate, and will ultimately prolong the pandemic, our vulnerability, with devastating impacts. The reality is that we are one small planet with one human family. Disease knows no borders, and through the pandemic and beyond, we are truly in this together. The point is, responding to COVID-19, recovering from the virus, and preparing for the future must remain our focus. We all have to learn from the pandemic. We can't forget what we have all been through, and we need to prepare for the future. And this includes our work at this very committee. Lessons learned and pandemic preparedness should be a focus of this committee. Each of us knows COVID-19 very personally. It has touched all our lives. Doctors, nurses, frontline workers, survivors, family members, and communities. And the virus has done so in ways we could not have imagined a year ago. All of us know families who are grieving loss. We need to acknowledge their pain and be there for them. We must address the grief, loneliness, and stress, and provide much needed mental health supports. And we need to lift each other up and inspire hope. We need to think of everyone on the healthcare front line who has been at this for a year. It wasn't a wave. It was sustained, and it has been grueling and hard. I thank the tireless frontline healthcare workers. And in Etobicoke North, particularly William Osler Health System, for their life-saving services. The Rexdale Community Health Center and its partners for their important community care, including providing health services, delivering food, and providing computers and internet access. A friend of mine who is a physician says that each patient who dies leaves a scar on the heart. We also need to think of all those on the front line who do not have the luxury of Zooming into work, but who provide essential services, like those working in grocery stores, to personal support workers, to truck drivers, everyone who work to keep our community and country going. We owe them so much more than our collective thanks. We must tackle the glaring inequalities, age, disability, gender, income, race, and more that have been laid bare by the pandemic. In Toronto, where I'm from, in August, the racialized people made up 83% of reported COVID-19 cases, while making up half of Toronto's population. They are more likely to live in poverty and poor housing, have precarious work, and be victims of discrimination. All these lead to worse health. All of us, we have all been touched by the pandemic. I think of the mother who not only has to work, but also help her young children learn. I think of students preparing for apprenticeships, college, and university, or preparing to make their start in the world, and what they have lost. A loss of contact with friends, a loss of activities, mental stress. 1 year is a long time. I think of grandparents in long-term care, scared and alone. Long-term care facilities bore the brunt of wave one, with more than 70% of deaths occurring in those over age 80, or about twice the average of rates of other developed countries. And tragically, it happened again in wave two. I think of the several long-term care residences in our Etobicoke North community. Deaths among seniors are not just numbers. Our seniors are people we know, people we have listened to, We have heard their life stories, learned from them, laughed with them, sang with them, and danced with them. I dread going back to our long-term care because I know those people, and I wonder who's not going to be there. I think about the 48th Highlander veterans at Sunnybrook Hospital for whom we danced. 8 decades ago, they stepped up for our generation and for future generations. Their motto was Julius Scubra. It means faithful forever. We owe all our seniors who have helped build this country safe and dignified care. The greatest tragedy of this pandemic is the lives lost in long-term care homes. I think of people with disabilities in congregate settings. I think of the homeless. I think of Indigenous peoples. I think of the taxi drivers and the truck drivers in the community I serve, who picked up travelers in the spring at the airport only to succumb to COVID-19. The point is, it's our families and communities that should be top of mind now, protecting their health and safety, their jobs, and their livelihoods. Think of the thousands who work here in the parliamentary precinct. Think of our clerks and the teams that support this very meeting. These are our colleagues, our friends, who work to maintain the People's House. What lessons do they want us to learn? What lessons do they want carried forward for the next pandemic, disaster, or for next time? What Canadians needed this past year, what they need a year in the pandemic, is to know how to best protect themselves, their families, and communities. And they need economic support. I strongly believe that our focus has to be protecting the health and safety of Canadians, to project jobs and livelihoods and the economic recovery, and not to score partisan political points. In order to protect the health and safety of Canadians, we closed the borders. We directly funded the provinces and territories. We bought personal protective equipment, testing kits, and we pre-ordered vaccines. The most important thing we can do to address the spread of COVID-19 is to vaccinate, test, contact trace, and isolate. Our government bought the vaccines, tests, provided contact tracers, and provided quarantine hotels. And in the spring, when the women and men of the Canadian Armed Forces were needed, they went into care for our elders, for our families. To protect jobs and livelihoods, the government put in place strong measures to protect businesses and workers. We had to do this because the virus could only be slowed or stopped by limiting social contacts. And this meant reducing economic activity. It meant shutting down workplaces and later limiting the number of people restaurants served. It meant asking people to stay home from work if they were sick or their children were sick. It simply would have been unfair to ask businesses to shut down and workers to stay home without compensating them for lost income. The reality is the best economic approach is to stop the spread of the disease. The next best approach is to help Canadian businesses and Canadian families weather the pandemic without losing their livelihoods and without going broke. We must provide meaningful investment to build our way out and to ensure our economy comes back stronger than before, laying a foundation for a green economy, an innovation economy, and a fair economy that supports good jobs for all Canadians. To rebuild from job losses and strengthen our economy, we will launch a campaign to create more than 1 million jobs. Families should not have to choose between their health and their jobs, and our families should not have to take on the debt that their government can better shoulder. Pandemics are not the time for partisan politics. It's time for the country to come together, to protect one another, to begin to heal. But we have to acknowledge the hurt first. And there are a lot of people who are hurting. We call daily into our Etobicoke North community to hear how people are doing. Our Etobicoke North families matter. They are good people. They work hard. What makes Etobicoke North such a special place to live, work, and play is that we welcome the world. We are proudly one of the most diverse communities in the country. We learn from one another, and we learn each other's beautiful cultures, languages, and religions. And we look after one another, and we lift each other up. We ask how our families are doing and what is on their mind. And the answers are invariably the same: protecting their health and safety, jobs, and economic livelihoods. My friends, we have done good work together in this committee in putting in place virtual voting and coming together to produce a report on the best way to protect Canadians and democracy should an election happen during the pandemic. But there is more good work to be done, important work. Well, we clearly remain in the throes of responding to the pandemic, and our focus must absolutely be the response. It will also be important for this committee to review the parliamentary precinct response. Was there a pandemic plan? Who was consulted in the development of any pandemic plan? How often was any plan reviewed? Once it was known that something new was circulating in late 2019, on what date was any pandemic plan first looked at? Was any plan updated in January and February? What actions were taken during January and February to protect the health and safety of all those who work on Parliament Hill? Was there any consultation with Canada's Chief Public Health Officer in December, January, or February? Was there any consultation with Canada's Chief Scientist? Was there a review of Parliament's response following the 2009 H1N1 pandemic? When is any plan updated following H1N1? Was a tabletop exercise ever run for Parliament following the H1 pandemic? Did each of the major groups in Parliament know about any plan? Security, pages, those who provide food, and more? Well, were political party leaders made aware
Point of order?
Yes, Ms. Vecchio.
Thanks very much. And I do absolutely appreciate all of the comments that Dr. Duncan is making, and I know that we've all seen that in our own communities. I would urge her that perhaps they could actually table these motions. We're talking about them today, but if we could get back to my motion, perhaps, and then we can talk about those potential motions in the future, because I think they're all very critical. But we have not seen the Liberals table any of these suggestions already. There's nothing on the table by the government at this time. So perhaps we can get back to my motion and then potentially talk about some of these great motions she is putting forward at a later time. Thank you.
I really thank my dear colleague Karen, who I have so much respect for. I am coming to a point here, and there are important points to make today, because our sole focus has to be the pandemic, not partisan politics. Were political party leaders made aware of any pandemic plan? Were political leaders ever asked to make their parties aware of any plan? It's important to review Parliament's response to see what action was taken, when action was taken, and was it taken early enough? One of my fears is that we will forget. Or perhaps should there be an election, would a new Parliament study the pandemic response, identify lessons learned, and implement change? And whatever we learn must be incorporated for next time, because there will be a next time. Pandemics are not a matter of if, but when. The point is, will we do our work so that future parliaments are better prepared? At this point, I think it's so important for all of us on this committee to recognize all those in the parliamentary precinct who have worked tirelessly to protect health and safety and to ensure a functioning parliament. My friends, I spent my adult life studying pandemics. First, the 1918 influenza pandemic, and then I helped business, industry prepare for pandemics. In fact, when H1N1 happened, the previous government reached out to me and included me in those conversations. The 1918 influenza killed upwards of 50 million people, more people than the Black Death of the Middle Ages, more people than all the fighting of the First World War. The entire pandemic lasted only 18 to 24 months. And I really want to bring this point home. The 1918 flu was a traumatic event. Doctors, medical professionals, and people seemed hesitant to talk about their experience. And because they were reluctant to talk or write about the flu, future generations weren't always aware of it. Despite its shocking mortality, historians largely ignored the flu, the 1918 flu, until the 1970s, when they explored the epidemiology and the frightening nature of the disease. Later, they examined the social cultural aspects, including how the disease revealed class and ethnic tensions. For decades, the 1918 flu was the forgotten pandemic, and for almost a century, it remained a medical mystery. The point is, there were lessons to learn in 1918, and 100 years later, there are lessons to learn in 2020. We have to learn the lessons, update our plans, and be better prepared for next time. Going forward, we must all be prepared. And I'll repeat that, we must all be prepared. It's governments, the private sector, non-governmental organizations, and international organizations. When we are not prepared, we face not only deadly impacts, but also devastating economic consequences, new inequalities and vulnerabilities. And a virus can quickly undo economic progress or impede the Sustainable Development Goals. Just over 100 years ago in 1918, and today in 2020, it's poverty, hunger, good health and well-being, gender equality, racialization, and economic status who determines who gets sick, who gets treated, and who survives. We must understand that pandemics result from the vulnerabilities we have created through our relationships with our environment, other species, and each other. We must urgently change course. The recovery must respect the rights of future generations. We must increase climate action, locking in carbon neutrality by 2050. And we must protect biodiversity. We must learn what we always learn following a pandemic, namely that science and public health matter, and not just when we are in crisis. Research institutions have a crucial role to play in both research and policy, in reviewing pandemic response, helping to define lessons, ensuring that we are better prepared. We have to learn from each pandemic. And they also need evidence-based advocacy. This year, it's science and public health will remain key to fighting COVID-19. But research matters beyond the pandemic. It is a fundamental building block of our country that requires attention, nurture, for a better future, environment, and quality of life for all. My friends, I appreciate this committee. I appreciate the work we do together. But this is not the time for partisan politics. We are in a race between the vaccines and the variants. And our sole focus should be, how do we get the vaccines to as many people who want them as quickly as possible? Our families, our communities want us to be focused on protecting their health, safety, jobs, and economic livelihoods. They're tired. We are all tired. People long for compassion, generosity, and kindness. What this committee should be looking at is the House of Commons response and how we can all be better prepared for next time. Thank you for allowing me to share my thoughts with our committee, and thank you, Madam Chair.
Thank you, Dr. Duncan. I know that this pandemic has really hit home for you and so many others. So we're always thinking of you. Next, we've got Mr. Blakey.
Oh, thank you very much, Madam Chair. And I guess I just want to recall for the committee that we're kind of at this point as a result of two main decisions. One was in 2015 by the now Prime Minister. There was a decision to try and address what were seen as political abuses of prorogation with the previous government. And so the Prime Minister made the decision to run on a platform that the way to try and mitigate those abuses was to require the government to report on its reasons for prorogation. And so now, you know, and of course there was no prorogation in the last Parliament, which I actually thought was too bad. I thought that a routine prorogation would have gone some way to just kind of help remind Canadians that prorogation is not always a bad thing. It's a bad thing when it's abused politically, as it sometimes is. But there have been a number, and we've heard this in testimony, there's been a lot of routine prorogations in Canadian history. The Manitoba legislature, under various, you know, governments of various political stripes, routinely prorogues every year. There's a new speech from the throne annually in the Manitoba legislature. And, you know, while the content can sometimes be controversial, the fact of having a speech from the throne is not. And so there's lots of different ways to use prorogation. This was a policy developed by the Prime Minister himself and that he ran on in order to prevent political abuses of prorogation. And then, you know, mid last year, he decided to prorogue. That's the second decision that got us to here, because then the government tabled an explanation, which was, as the Prime Minister wished, brought here to proc. And we've heard arguments on both sides. Obviously, there's some disagreement about some of the real motivations for the timing of the prorogation and the length of the prorogation. But what we have heard from a number of witnesses is that this all does ultimately come back to the Prime Minister, because it's the Prime Minister who ultimately makes the decision about prorogation and how to advise the Governor General. So I've said this before on the record. I've you know, and there's been some conversations off the record. I know, you know, one of the arguments that Liberals have made at length when they're on topic here at this committee is that, you know, the demand for documents and the number of witnesses is, you know, is an unreasonable burden on government. Again, I think reasonable people can disagree about that. I do know that some other committees are making headway in terms of getting some of these witnesses before a parliamentary committee. I do think that Canadians want to hear more about what happened with the We Charity. But I think in the context of our study, and I've said this before, I would be satisfied for an hour of the Prime Minister's time for him to come here to honor his commitment to be held to account for the use of prorogation and to offer that explanation. Now we've had a document tabled. We've had the government House Leader here. I'm not of the view that he's provided particularly good arguments. We hear sometimes from Liberals on the committee as if we're judges charged with making some kind of determination. This isn't a judicial hearing. Our work here is to hold the government to account for its decisions. And just accepting a written statement at face value doesn't really do that. So we've heard a lot of testimony identifying the Prime Minister as the principal decision maker. We know that the Prime Minister is the principal decision maker. He's the only one with the constitutional authority to advise the Governor General to prorogue Parliament. So all roads lead back to him. It's his policy. This was his idea for how to prevent political abuses of prorogation. And it stands to reason, in my view, that he ought to come here and talk to the committee about it. And that would be the way that he could set an important precedent for how this mechanism to prevent political abuse of prorogation is meant to work. So I've said it before, I'll say it again. For an hour of the Prime Minister's time, I think the rest of this motion can go away. I would be satisfied to have the Prime Minister here to answer questions about prorogation for an hour. That's not an unreasonable burden on the government. It's not an unreasonable burden on the Prime Minister, particularly in light of the fact that it's his own policy that has brought us to this point. And I think he would do well to honor that policy and to set the right precedent. And I imagine that, you know, were we having this conversation about the controversial, politically controversial prorogations of Stephen Harper, that Liberals would be keen, if we were all here at that time, to have then Prime Minister Harper appear to give some reasons. And I can imagine that in some circumstance in the future, where prorogation has been politically abused, or there's the perception of political abuse of the power of prorogation, that some Liberals might think it appropriate for the Prime Minister, him or herself, to appear before the committee to provide reasons and answer questions, which is being held to account, which is one of the principal functions of Parliament for decision making. And it's a cornerstone of responsible government that ministers and decision makers be held to account for the decisions that they make. So, you know, I hear in the Liberals' comments at committee that somehow this is an intractable situation, or that, you know, they're forced to hold up the committee because a vote on this would issue in some kind of unreasonable demand on the government. An hour of the Prime Minister's time to honor his own policy is not unreasonable. And that's a way to break this loggerheads. A public commitment from the Prime Minister to appear. He's already been invited. All he has to do is say publicly that he'll accept that invitation and come here for an hour, and we can move on to other important work. As other members, and particularly government members on this committee, have have said many times that we need to do, and have given some examples even of some of the things that we might move on to. So I'm prepared to do that, but I'm not prepared to do that on pain of giving up the idea that we would set the precedent that the only person who really makes the call about prorogation would not be here to speak to that and to be pressed on the reasons of prorogation, because I think that's part of important accountability work. So that's what's there. A public commitment from the Prime Minister to appear from an hour could resolve this loggerheads, and that is what's being filibustered here. It's not the lengthy motion that's before the table. I think there's good things about that. I think there should be accountability on those issues. I'm happy that other committees have found a way to make some more progress on those things. But let's not pretend that it's an either or scenario. Either all of this motion exactly as it is, or this ongoing, chat fest by Liberals at the committee. There's other options that we can proceed with that would help us do more meaningful work and get value for the resources that continue to be dedicated to this committee, despite the fact that we're not getting a lot done. Thank you.
Okay. Sorry, I was about to say something earlier, but I also didn't want to interrupt. Mr. Nader had fallen offline, and at that point, I felt like I saw some of his colleagues looking around, Conservative members. I just wanted to say I was going to wait for him. I was informed, and so if anything came to a vote, that's what I'll generally do. If somebody, to no fault of their own, gets booted out and doesn't intentionally leave, then of course I would not. I'd wait for their technical difficulties to be resolved before any amendment or any issue goes to a vote. Okay, at this point, do we carry on with the speakers list, or is this a formal proposition amendment?
There's no amendment being suggested. I think what we need is a public commitment from the Prime Minister to appear before the committee. The invitation's already been made. All this motion would do is, reassert that invitation. But I think, Liberal members of this committee could do that very effectively in an informal way, without a motion of the committee. But I don't see a reason to decline a motion that has a lot of merit in terms of what we might hear and things that I'm interested to hear, and that I think a lot of Canadians are interested to hear, frankly. If it means that we're just going to move on and not have the Prime Minister appear for what I consider to be his own study. And so I'm not prepared to move on this without that commitment from the Prime Minister. And there's no amendment or motion that's going to get that for us by virtue of a resolution of the committee. That's a decision that the Prime Minister continues to take, which is to forgo this invitation. And that's what's causing the logjam. But I think in terms of a lot of the other concerns Liberals have raised, even if we don't agree, the crux of this Parliament is negotiation and compromise. So I don't come here expecting that I'm going to get everything I want, or that everything is going to go exactly how I want. But I do expect for people to sit down and try and hammer out some reasonable compromises. And the Prime Minister appearing for an hour on a study that's the direct result of his proposal on how to prevent political abuses of prorogation is an eminently reasonable proposal. And I'm disappointed that we haven't seen any action on that. There's been conversations at this table and particularly around this table that haven't yet issued in that commitment on his behalf. So we continue to have what I think is a structurally flawed conversation, because it rests on the idea that we either accept this motion whole hog or we move on as if there's no reason for the Prime Minister to defend his decision to prorogue Parliament. And I don't accept that. And I do think that there's a lot of good things in this motion. I do think there's some accountability questions about the We Charity as yet unanswered, but I do recognize that some progress is being made at other committees, and I'm willing to try and move on to other important work if we can hear from the Prime Minister on an issue that is central to his constitutional powers. So if we could do that, that would be great. I recognize nobody at this committee can make that decision for him today, but I don't want to continue on this conversation pretending as if there isn't a way out when there is. It's an hour of the Prime Minister's time, which I don't think is a lot to ask. So let's have the conversation, but let's stop having it as if there isn't an offer on the table, and as if that offer isn't reasonable, because an hour of the Prime Minister's time is very reasonable for his own study to do justice to his own proposal and set a good precedent that Liberals now may not feel is warranted, but I'm sure will at some point in the future feel would have been a good precedent. So, you know, let's get on with doing that good work and then go on to something else that we can make some progress on, hopefully. And I think that has to be the spirit of this Parliament. And we're not seeing that in this ongoing filibuster. There's no movement on the part of the government. That's the other side of this. So if there's no, you know, plausible offer for how to meet somewhere in between coming from the government, I think people need to recognize that that is itself a form of toxic partisanship. And there are people willing to talk about solutions for how we move forward in a less partisan way. But jamming up this committee for meetings and meetings and meetings on end because they know they're going to lose a vote on a motion is not a nonpartisan approach. Negotiating a solution is. So if they don't like this offer of the Prime Minister appearing, I think they need to start talking about some other options. And I appreciate Ms. Vecchio's frustration that she voiced earlier, which is, you know, what are the other options then? Put something on the table. But here we are, the opposition has a proposal. The government's made it clear it doesn't like it. And yet we're at a loggerheads because we can't get any kind of interesting counteroffer on the part of the government. So here we are, and here we will remain until there's some movement on this. And I'm proposing something. It's not up to this committee to decide whether that's a good offer or not. But I hope that members on the committee will be taking that offer back and urging people on their side to take that seriously. At one point, it seemed there were some folks on that side that were taking it seriously, and then the trail went cold. So I think we should be thinking about how we get back on that trail, which will allow us to do some meaningful work, which is something we've neglected to do for some time now.
Okay, thank you, Mr. Blakey. Do we have the correct order, Mr. Clerk? Is it Mr. Lauzon and then Mr. Sims?
We have Mr. Lauzon. Then at one point we had Madame Petitpas-Taylor, but her hand has since been lowered, and then Mr. Sims, and then Mr. Turnbull.
Okay, I felt like I saw a slightly different order earlier. Okay, Monsieur Lauzon, you have the floor.
Merci, Madame la Présidente.
Thank you, Madam Chair. Thank you, Mr. Blakey, for your comments. And I also wish to congratulate you for your French. It's very pleasant to hear you speak French as well. We know that you're very talented. But I cannot agree with you by saying that there's no room for debate. When you say that what Canadians want is to hear the witnesses as outlined in this motion, well, I can tell you that since the beginning of the pandemic, since the tabling of this motion, I've consulted with thousands of citizens in my riding and throughout Canada. consulting them, and I can tell you that there isn't a single Canadian who asked me personally that a Prime Minister.
Yes, Ms. Vecchio?
Thanks very much. I just wanted to perhaps suspend. I think after listening to Mr. Blanqui, and I recognize that now listening to the first couple seconds of Mr. Lauzon, this may be a really great time for the parties to go back and reflect on opportunities so that we can find a workable motion so that we can do something in this committee rather than continue to filibuster. So I recognize that if we do not suspend, we'll just continue to listen to hours and hours of filibustering. But perhaps this is a good time for the parties to reflect to say, what are they willing to, or what in this motion is acceptable from the government? They seem to be the ones who have the most difficulty with this. Perhaps it's a great time to suspend, reflect, and come back on Thursday, or I'm sorry, following the Tuesday after our break week, and come back to this issue on March 16th.
I'll confirm with Mr. Lauzon, but just so that we have like the procedural aspect of this proper and everybody understands it. So on a point of order, you can't necessarily put a motion to suspend or to adjourn. But I mean, of course, you've raised the issue to my attention, and I can, of course, assess if we have consensus from the room. And Mr. Lauzon does have the floor, so he could either move, or if Mr. Lauzon thinks that we may have consensus and Ms. Vecchio feels it, then we could suspend for today. Mr. Lauzon?
I just want to continue to finish my point for today, and we'll continue on Tuesday after the break week.
Okay. Go ahead, continue your point.
J'étais sur une lancée.
So I was responding to Mr. Blakey. Indeed, what you're bringing here isn't necessarily an amendment. What you're saying is that you want the Prime Minister for an hour's time. But with regard to the rest of the motion, well, it's just as valid. So for us, we deem that indeed we have enough documentation and witnesses here in order to produce a report. And to better respond, because you talked about partisanship as well, saying that this is partisan, what we're doing here, it's regrettable that we find ourselves here, and you're right, because of the opposition members. With regard to the motion on the table that we have before us today, well, I agree fully that it's the prerogative of the Prime Minister to advise the Governor-General on prorogation. And you mentioned this, Mr. Blakey, in your remarks, that it's the Prime Minister's prerogative. That's exactly what the officials from Privy Council told us. They appeared before the committee, as well as academics. And some of the academics who appeared before the committee stated that prorogation is legitimate if the Prime Minister has the confidence of the House. That was the case for prorogation in August 2020. All of the members of the committee will remember that indeed there was a confidence vote in the House following the speech from the throne. All of the members of this committee didn't vote in favor, but a majority of the House did, proving, indeed, that the Prime Minister did have the confidence of the House. What was the result of the vote? 329 MPs participated in the vote. Of that number, 177 MPs voted for, showing that they did have confidence in the government. Is that not a parliamentary majority that voted in favor? Our NDP colleague from across, does he not know that his party voted in favor of this? We can remember that. His colleagues from his party voted in favor of the motion. The MP from Skeena-Balti Valley voted in favor. The MP from Transcona as well. The MP from No Salads Power River voted in favor. And even The MP from Rosemont Petite Patrie voted in favor.
Ici de South Okanagan West, Coataway, a voté en faveur aussi. Le député de Victoria a voté en faveur. Le député de Vancouver Kingsway a voté pour. Le député de Scott-Duvall a voté pour. Le député d'Esquimed Sinaïch-Souki a voté pour. Le député de Winnipeg Centre a voté pour. Le député d'Hamilton Centre a voté pour aussi. Le député de Saint John S a voté pour. Le député d'Algoma, Manitoulin, Kapuskasing a voté pour. Le député de Courtney Alberni a voté pour. Le député de New Winster Burnaby a voté pour. Le député de Vancouver Est a voté pour. Le député de Cowing Anne Malahat Langford a voté oui. Le député de Windsor West a voté pour. Le député de London,
Point of order.
Fanshane, a aussi voté pour.
Point of order.
Yes.
But I mean, I felt but I also wanted to just 102 right now, and if we are going to allow the subcommittee to be able to have their meeting on private members' business, then I think we're going to have to cut it at this point. And I feel really bad saying that to you, Monsieur Lauzon, but okay. Either we go on for a long time and have them reschedule, or we allow them time to be able to switch to the other committee. Is that okay?
I'm okay. I'm okay to continue the Tuesday after the break week.
Okay. All right, Monsieur Lauzon, is everyone else okay if we suspend then? Okay, seeing that there's no opposition to that, we are. Oh, yes.
Why don't we suspend till Tuesday during the break week? I, for example, have an open schedule Tuesday at 11. So why don't we suspend till Tuesday during the break week? So hopefully we can deal with this motion and put it to bed finally.
Well, that's not really my call at this point, but I'll take that suggestion and take a look if that is possible. So we will suspend until either our next scheduled meeting or until if we can schedule one during that time. Yeah,
Point of order. When would we get notification of that? Because as I said, I think there's many people that would like to get this matter dealt with. If we could come, as I've indicated, if the Liberals can come to an agreement on something, perhaps we can all sit down and once again and work on Tuesday rather than prolong this, so that we can get to all of those important motions that our Liberal speakers have actually brought forward. Thank you.
I don't really know, because there are so many. Even last break week, we saw that there were so many meetings that still took place, and I don't know what the capacity is, a little less during a constituency week. So I don't know the answer to that, but I can try to get that to you as soon as possible. So we will suspend for today. Thank you, everyone.